Good afternoon. I would like to thank you for coming today. We're here to present Certification in Clinical Documentation Integrity, what it is and why you need it. This program is presented by the Association for Integrity in Healthcare Documentation. My name is Dr. Betty Bibbins. I am President and Chief Medical Officer for DocuComp LLC, Executive Physician Educator, and Dean of Faculty for the Certification in Clinical Documentation Integrity Program. Today, we all know that there's stormy seas in regulatory environment. This is a time of major change. This change can cause a lot of instability, just going from what is there in the past and what the new stability will be in the future. We're here to work together to get through these stormy times. Regulatory changes. The regulatory changes that are sweeping through healthcare are major changes that are occurring predominantly in Medicare, which is the #1 third-party payer or insurance company in the United States. But also, there are major changes occurring throughout the private sector. But with Medicare, the changes include the RACs, the MACs, and other regulatory agencies such as the ZPICs and, becoming effective in 2011, the Medicaid RACs. All of these are meant to add stability and financial sustainability to healthcare in the future. RAC implementation complete and increasing its complexity of reviews is occurring not only in documentation but also in medical necessity, which means the severity of illness is being captured as well as capture of justification of utilization of resources. Why should I, the healthcare professional, care? The American Hospital Association creates quarterly reports on RAC activities throughout the United States and has found the following: that more than 2/3 of hospitals that responded to its RAC track experienced RAC activity as early as the first quarter of 2010. RACs are primarily engaging now in complex reviews focusing on inpatient coding. Now, this is just 2/3 of the respondents of the hospitals back in early 2010. RAC track respondents reported complex reviews of medical records totaling over $432 million nationwide for one quarter. 91% of hospitals reporting complex denials experienced denials for inpatient coding errors. Keeping in mind that inpatient coding errors are not just purely the coding errors, but errors where there was insufficient documentation to support the codes that were selected, or insufficient justification of medical necessity, utilization of resources to support the codes that were coded. 76% of responding hospitals reported that their RAC impacted their organization in first quarter 2010, whether they actually experienced direct RAC reviews or not. In other words, significant hospital resources are being utilized to prepare for RAC reviews if they may come, along with potential resources to be reimbursed back to Medicare. Why should I, the healthcare professional, care? Because managing the RAC process is spread across many types of hospital staff, creating significant administrative burden. These staff include not only coding, but going back to the medical staff of documentation, We have case management, medical necessity. We have also coding, as mentioned, nursing in order for capture of all information, as well as compliance across the board, and also revenue cycles to make sure that the appropriate billings are done. 51% of responding hospitals reported increased administrative costs just in getting all of these departments up and prepared for potential RAC impacts. If you want more information on this, you can be found in its entirety at www.aha.org, which is the American Hospital Association. How can CDI help? We focus on documentation integrity, which is the entirety. It's not simply the documentation improvement. Looking back upon traditional clinical documentation improvement, this is where review of records are done for clinical specificity, principal diagnosis, solidification, chronic, comorbid, and complicating conditions, as well as major chronic, comorbid, and complicating conditions captured. There is initiation of verbal or written queries, follow-up on these queries, tracking and trending of the queries, where they responded to by the physicians, and if not, then what was the response or why. Calculating case mix impacts on the facility, and calculate and reporting reimbursement impact on the facility. How can you, the healthcare provider, be helped by CDI? Because through clinical documentation integrity,